Am I audible? Yes, ma'am, you are audible. May I have the permission to start? Yes, ma'am, you can start. A very good afternoon to you all and a warm welcome to this national. At the outset, I thank Dr. Deepti Shukla, the Chairperson Organizing Committee, and Principal Samarpan Institute of Nursing and Paramedical Sciences for giving me an opportunity to speak on a very pertinent topic during the national webinar series on the theme Evidence-Based Research Application in Modern Nursing. In continuation with the national webinar series, in the third day session, I bring greetings to you all from College of Nursing, Armed Forces Medical College, Pune, the Oxford of the East, or Mecca of Education. In the next 1 hour, I will be deliberating on the topic Systematic Literature Review and Writing Bibliography. You may stop me as and when I am not audible. Systematic is that which is conducted according to clearly stated scientific research methods and is designed to minimize inherent to traditional and narrative research. As per Gow, Oliver, and Thomas, it is a type of review that collects multiple research studies and summarizes them to answer a research question using rigorous methods. It is also a search that is mainly performed in the electronic literature databases, but it also includes manual searches, wherein we look for reviews of reference list in relevant sources, identify the literature which is not yet published in order to obtain a comprehensive overview of a research topic. If you see the hierarchy of scientific evidence, the case reports, opinion papers, letters, case control studies, cohort studies, randomized control trials, all this if you see, the strongest is systematic review and meta-analysis. A systematic review is the highest form of knowledge in the science. It extracts and interprets data from published studies on the topic and then analyzes, describes, critically appraises, and summarizes interpretations into a refined, evidence-based conclusion. That means it is a type of research. In this, what we do is only we go through all the published studies and the non-published studies and get to the data collection. What are the objectives of systematic literature review? The objectives are avoidance of research redundancies despite a growing amount of application. You can identify the research areas, gaps, and methods. It is an input for evidence-based management, which allows to base management decisions on scientific methods and findings. And lastly, it helps us in identification of links between different areas of research. What do you think then is the significance of systematic review? The significance is that large amount of medical literature requires clinicians and researchers to rely on systematic reviews in order to make an informed decision. Systematic reviews minimize biases. It is more of a scientific method of summarizing literature because specific protocols are used to determine which studies will be included in the review. What next are the characteristics of this systematic review? Even in systematic review, like in a normal research, you also will have a clearly stated title and objectives, but it will be a comprehensive strategy to search for relevant studies, both published and unpublished. Explicit and justified criteria for inclusion and exclusion of the study will be written. You will make a clear presentation of the characteristics of each study which you have referred, and an analysis of the methodological quality is being done. A comprehensive list of all studies excluded and justification for exclusion will also be given in the systematic reviews. Continuing, in systematic reviews, clear analysis of the results of the eligible studies, that is, statistical synthesis of the data, which is known as meta-analysis, will be done if appropriate and possible, or qualitative synthesis will be done. And a structured report of review clearly stating the aims, describing the methods and materials, and reporting the results like any other research study will be carried out even in systematic review. What then are the key characteristics? Every systematic review will have a clear set of objectives, a reproducible methodology, the assessment tools of quality of study, the synthesis of the findings of various studies, both published and unpublished. Hence, the main activities of a systematic review will be identifying relevant research, systematically critiquing research reports, synthesizing all the findings, and lastly, understanding conclusions from the various research you have perused or reviewed. What do you think then is the need for systematic review? There is lots of literature which is available. The volume of the published material makes it impractical for an individual clinician to remain up to date on a variety of common conditions. Hence, there is a need for systematic review, wherein you will review all the published and the unpublished material in your study. Further, this is complicated when individual studies report conflicting conclusions, a problem that is prevalent when a small patient samples and retrospective designs are being used. We should do comparison with the intervention, and lastly, we should know what is the outcome and what happens and what is the outcome. In the planning phase, the second objective will be to develop a review protocol in which you will identify the study selection criteria, the selection procedures, study the quality assessment checklist and procedures of your problem, do the data extraction, and then synthesize the extracted data and disseminate the strategies, whatever you have observed in the published and non-published literature. The second part of the systematic review is the conducting phase, where you actually do the review of literature. In this, the data which is collected what you will do is analyze. So, systematic reviews, you will do meta-analysis, you will do meta-synthesis, or you will have a mixture of both meta-analysis and meta-synthesis. That is why it is the highest evidence scientific presentation. Like in every research study, even in systematic review, you will have a hypothesis which is based on the principles of hypothesis testing, and the hypothesis must be conceived on the priority. Even in this study, you will focus on the question, that is, what is your population, what are the interventions, what are the outcomes, and what are the study designs which are appropriate to the study. You will make all such structured questions and then have the inclusion and the exclusion criteria like for any other research methodology study. In the inclusion and the exclusion criteria, after you have defined your question, you will say that these are the criteria you will include in your systematic review and these are the criteria which you will exclude. So, once the study questions is formalized, we as researchers, the authors must compose a comprehensive list of the inclusion and the exclusion criteria. Why did I mention the word authors? Because when you are trying to do a systematic review, as an individual, you may be biased. So if you have one or two individuals, that is why it is known as authors. Or your co-partners in research, they are known as authors. They must compose a comprehensive list of the inclusion and the exclusion criteria. Why do we need to do it? To avoid selection bias, which should be agreed upon and formalized before data extraction and analysis. After you have done this, like any other research study, you will do a comprehensive and reproducible literature search in foundation of systematic review. That means you will go through all the literatures whichever is available in the electronic database or in unpublished data. When you are doing this literature search, you will face a few challenges. The challenges are you will have a database bias. That is, no single database is likely to contain all published studies on that given subject. Then it is a challenge which you all will face while reviewing the published data on the electronic media. Then you have publication bias. That is, certain articles, depending on your problem statement, may be published and certain are unpublished. That is why it is known as publication bias, in which selective publications of articles that show positive treatment or effects and significance will be available. And at times, certain data which is unpublished also may be available. Like for example, in conference proceedings, correspondence with experts, and search of clinical trial registries when you do, certain data may be unpublished. So that is why it is publication bias. Other than this, you may also have English language bias and citation bias. That is, English language bias occurs when reviewers exclude papers published in vernacular languages other than English. And citation bias occurs when studies with significant positive results are referred in other publication compared with studies with inconclusive or negative findings. That is known as citation bias. After you have done literature review with all the challenges you face, What you do is you get a list of data to be extracted, and which you have agreed upon is nothing but data collection depending on the design stage of your study. After you have done, the collected data will include your study characteristics, sample demographics, and outcome of the data also will be collected. In the data collection, we also should ensure that the data extracted from the systematic review is accurate and reproducible. That means you should have copyright permission so that you can reproduce that data. It should be performed by at least two independent readers. Then I said you have to have various authors. It is also necessary to design a review-specific data extraction form so that the same data are extracted from each study and missing data is clearly apparent. That means you should have a checklist tool for data collection. Certain quality assessment tools, validity, how is it being done? The validity of a systematic review ultimately depends on the scientific method of the retrieved studies and the reporting of the data. That is how validity of a systematic review is being done. In randomized controlled trials, RCTs are considered to be more rigorous than observational studies. That means you need, in the systematic review, you need to give more importance to RCT. And in a review based on well-designed RTC will likely be more valid and accurate than review based on observational studies or case reports, because in a scientific study, always observational studies and case studies have the lowest level of evidence as compared to RCT, which is immediately after systematic review. And the most common way to assess and report study has been using a composite numerical scoring instrument. And other two important things are there are many different quality assessment instruments in systematic review where the instruments have been published in the literature and are most designed for randomized controlled trials. The commonest one which I have taken into consideration is the GITA score and the Chalmers score are two examples of quality assessment instruments. In which, how do you do this GITA score and see the validity of your systematic review? Whenever there is randomization in a study, you will give 2 points. Whenever there is double blinding, again you will score 2. And whenever there is withdrawal or attrition, you will score 1. And then you will see the validity of your systematic review. The next slide will show you an example of how do you do scoring using a GITA score, that is randomization, blinding and dropout. That means you will look out in the systematic reviews for randomization, for blinding and dropout or attrition. And then you will collect all the data. Once you have collected the data, you need to synthesize the data. How do you do it? The data which has been extracted, their quality and validity will be assessed with various quality assessment tools, and the outcome of the individual studies with a systematic review may be pooled and presented as a summary outcome or an effect of your review of literature. And the authors or the research workers will summarize the heterogeneous data qualitatively. Data that are very conflicting and widely variable should not under more quantitatively. When can you summarize the data which is synthesized numerically? When data are not too sparse, of too low quality, or too heterogeneous, in those cases, you will not synthesize the data numerically. Like, for example, the patients, the interventions, and the outcome in each of the included studies are sufficiently similar. In those cases, you will not use the data in a systematic review to synthesize it numerically. Certain living systematic reviews are nothing but biggest example is a Cochrane review, which all of you must have heard of. If you see the living systematic reviews, they are relatively a new kind of high quality, semi-automated, up-to-date online summaries of research which are updated as new research becomes. That is living systematic reviews. The essential difference between living systematic review and conventional systematic review is only publication format. That means this data is on the electronic database. The example of living systematic reviews are Cochrane review, which is very dynamic, persistent, only available to you online, and evidence summaries are updated as and when required and as rapidly as things are changing and as frequently as they are getting updated. Hence, if you see a good systematic review, will formulate a good question, conduct a extensive literature search, refine the search by applying predetermined inclusion and exclusion criteria. The extracts are being appropriated as per their quality and validity, and the synthesized data is interpreted and the data reported. And thus, a good systematic review is available. I have done with systematic review. The second topic is bibliography writing. When you are doing a systematic review, you are looking into lots of items or literature. Search is so extensive that you need to know how to write or cite these references. That is why my next topic is bibliography or bibliography writing. What do you mean by bibliography? It is a science of transmission of literary documents in an orderly list of resources on a particular subject, or it provides full reference information for all the sources which you may have, which is consulted in preparing while writing a thesis, or it is a purpose, bibliography is a purpose to allow the author to trace the sources whichever is available and whichever is used. So, the elements of a bibliography are you have an author, because anywhere, any article or any reference has an individual tag to it. That is the author. Then you have a title of the document, the date or year of publication, the place of publication, the edition, the periodicity, and series. These are the important elements in bibliography. Keeping all these elements of bibliography in mind, what you do is referencing. What is referencing? It is a standardized way of acknowledging the sources of information and ideas that we have used in our assignments and which allows the sources to be identified. That means you have taken an obligation for referring all those sources of information But please remember, whenever you are doing referencing, you should avoid plagiarisms. You should verify whether the quotations, whatever you are using, are right. It will also enable readers to follow up whenever you are quoting or citing the reference. And lastly, you will understand what we have written and cited the author's work. That is why we have to undertake referencing. When do you, when are you to cite a reference? You are supposed to cite a reference whenever we copy a word or paragraph from a journal, article, or book. Secondly, whenever we copy a paragraph from a website, when we write in our own words or ideas the extract from a journal, article, or book, and when we write in our own words the ideas from a website, every time we need to cite a reference. That is why, if you have seen my earlier slides, I have at the end cited the reference material from where the definitions have been taken in systematic review. The three methods which are included whenever you write a paper are citing or citation, paraphrasing, and summarizing. What do you mean by all these three things? That is citation, paraphrasing, and summarizing. Citation means you should repeat the original text word from word, and include a reference to the original author of the source document. Reference material. Paraphrasing. Paraphrasing means you are taking the extract and retelling a passage of that original text in your own words and sentence structure. Then it is known as paraphrasing, but you are acknowledging the author of the original text. That is why again you have to cite a reference. This is the second method of citing a reference, that is paraphrasing. The third one is summarizing. Summarizing means reproducing only the most important ideas and main points of the source using your own words. That means summarizing means it is a large statement in a form of a shorter explanation. That means you have read ample material in a journal or a book or a article, but you are making it in a shorter form. Then it is summarizing the data. That is why it is known as summarizing. And when even you are summarizing the data or using the abstract, you have to cite the original source of reference. That means you are acknowledging the author. All these three things, that is summarizing, paraphrasing, and when we are using, you should know, or citing, you should know when to use what. Direct citation is done in a situation when exact wording of a passage is very important. Then you will always use citations. Then the original statement is well formulated and you will feel it will enrich your writing. That is why you will write it verbatim. In those cases, you have to use, if you feel that is going to bring importance to your study, then you will cite it directly with permission. Paraphrasing, as told to you earlier, it can be used in research papers and essays where you may reformulate it and find out and emphasize on the important or the key points as related to your study. That is paraphrasing. And the purpose of summarizing or summary is very similar to that of paraphrasing, but long sentences are made into short ones and you only summarize the whole article in 100 words, 200 words or in a paragraph. Then it is known as summary. Very important thing which you all need to know when you are citing references is avoid plagiarism. What is plagiarism? If you quote or paraphrase another author's work without including a reference to it in your study, then it is known as plagiarism. In simple words, it is nothing but cut, copy and paste. Not only it is very easy to detect plagiarism these days because we have plenty of online services and software which are available to check plagiarism. In case we are doing research studies these days, only 10% of plagiarism is accepted whenever you are doing any systematic review or any research study. And very good softwares like Turnitin are available for checking plagiarism. So that is why we should be aware of plagiarism. Citing is nothing but acknowledging within your text the document from which you have obtained the information. And reference is the detailed description of the document from which you have obtained the information is nothing but referencing. So, in other words, in short, referencing means a way of demonstrating that you have done the reading. We come across two terms, reference and bibliography. These two terms are synonymous, we feel, but they are not synonymous. References and bibliography are two different things, but we use it synonymously. What do you mean by reference? Reference or references are those items that you have read and specifically referred to in your work and your list of sources at the end of the assignment. Then you will write all those articles, books, essays, or any item, whichever you have reviewed in under the title references. If you have included it in your work, again I repeat, if you have included it in your work, then you write it as references. The next one is bibliography. Bibliography is a list of everything you read, whether you have cited, you have paraphrased, or you have summarized, is not written in your, but you have read that literature extensively. Then you may write it in the bibliography. That means you have read extensive literature. That means bibliography will contain all the sources that have been cited and those which have been found to be influential, but you did not require to cite it in your research study. In other words, in short, bibliography gives an overview of which authors have influenced your ideas and arguments, even if you do not specifically refer to them. That means you must have done an extensive bibliographical search of 200 journals. But when you're writing it under references, you will only quote 20 or 100, whatever, depending on your study. That is the difference between reference and bibliography. Now, when you are writing a reference or a bibliography, there are certain referencing styles which have to be followed. They are also called as citation styles. That means, how do you write all these? The various referencing styles are APA, MLA, Howard, Chicago, Turabian, and Vancouver. I will just briefly tell you what is APA, MLA, and all these citation styles. APA, the full form is American Psychological Association. It is an author or data-based style. This means emphasis is placed on the author and the data of a piece of work to uniquely identify it. Whenever you are using this, you will use an APA style where you give emphasis to the author. MLA or Modern Language Association is often applied by the students who do research in arts and humanities, particularly in USA, and it is one of the commonest citation styles. So, Howard is very similar to American Psychological Association, which is very popularly practiced in both UK and Australia. We have the Vancouver style or the Vancouver system, which is mainly used in medical and scientific papers, which we all usually adopt as a citation style. And lastly, which is not of much importance, is Chicago and Turabian. Only for your information, I have put it that they are two separate styles but are very similar, just like Harvard and APA. And they are used by students who do research in history and economics. But in our setup, we use the American Psychological Association citation style, the Modern Language Association of America, and lastly, the Council of Biological Editors. What is APA style, American Psychology Association? If you have to cite a book, then in those cases, the author's last name will come first, the first name or the initial next, the publication date, the book title, additional information, the city of publication, and the publication company. This is an example of the American Psychological Association citation style for citing of books. This is how you will write, wherein the title of the or the initial is last and then the name is first. It is, he may be T. Allen, but we will write it as Allen T. And the year of publication, that is 1974, and the book title, that is Vanishing Wildlife of North America. Washington DC is the additional information which you want to give, and the city of publication is Washington DC, and the publication company is National Geographic Society. For magazines and newspaper articles, the APA style is the author's name, the first name initial, publication, article title, periodical title, volume number, issue number, and the inclusive pages which you have used in your study. Then you will write in APA style. For magazine and format, you will follow this format. The CBE style, if you are using for books, this is the way you will write, wherein again, which is similar to your APA style I told you. This is in CBE style where you will write for magazines and newspaper articles. Vancouver style, we in medical sciences and nursing, we use the commonest way of citing is the Vancouver style of referencing. In this, the numbered referencing style is commonly used in medicine and science. And when we cite someone's work in our essay, we use a number to refer the reference. And our reference list at the end of our document will provide full details of the reference and correspond in sequence to the numbers in the text using consecutive numbers. That is why we use Vancouver style of referencing. While citing in the body of our essay, Vancouver style, the same number is used for that reference. The numbers in text can be superscript or can be displayed in brackets. And the numbers must appear after a full stop or comma, but before colon and semicolon. When citing more than one references in that paragraph, you can join consecutive references with an hyphen and say that 1 to 5 have been written, and the 1 to 5 references will coordinate with that paragraph whenever you do a review of literature. When citing multiple references that are non-inclusive, separate the references with commas. That is, you will write it as 2, 5, 8 and 10 in that paragraph. Vancouver style of writing a book reference is like this, what I have shown to you in an example. If you are writing regarding KD Tripathi, you will write it as Tripathi KD, Essentials of Medical Pharmacology, 6th edition, New Delhi, JB Brothers Medical Publishers Private Limited, published in the year 2008, and you have referred page number 757 to page 765. This is how you will cite a book reference as per the Vancouver style. This is a diagrammatical representation of how do you do it, from where you will take the author of the chapter, title of the chapter, the editor of the book, then the title of the book, the place of publication, the page numbers, and the date of publication. All this you will take and you can write it, and this is how it will look like. When you cite a chapter in a book, and when you cite a journal, this is how it will be. The author of the article, the title of the article, the title of the journal, the volume and issue of the number, the date of publication, and the page numbers wherever you have cited from. So, in Vancouver style, this is the commonest one. This is how you will be writing. The rules to cite the internet sources vary whichever depending on the practice what you use. Very specific to Vancouver style is it is indexing friendly, librarian friendly, reviewer friendly, because these days when you do your Mendeley search, very easily you can cite all these articles and it will come in a very systematic manner. It reflects a librarian's worldview. Author or writing is just a number. A journal, its volume and other items are all helpful for categorizing. It will help you in indexing for the NLM. It can help you detect plagiarism. And last but not the least, it is helpful for the editor or the reviewer too, whenever you are doing systematic reviews. I have further shown you in my slides how do you write when it is a single author, an article, when it is multiple authors, how do you write? When it is citing of a newspaper article in Vancouver style. All these I am just running through because all these slides, if required, I will share it with Dr. Deepthi and it will be made available to you. This is in Vancouver style of writing a single author. This is example of multiple authors. Vancouver style which you can use in dissertation or thesis. When you are referring World Wide Web, www site, when you are referring, how do you refer is in a Vancouver style is mentioned. This is in text citations. That is when you are quoting those words directly into your work. How do you write it in Vancouver style? This is how you will write it as superscript and subscript. The scholarly journal articles in Vancouver style citation. And this is the sample reference list in Vancouver style. This is how you will write single author, multiple authors, and internet resource if you are using. With this, I have completed my talk on systematic review and writing of bibliography. If you have any questions, I may take it. Otherwise, I thank you all for patient hearing. Students, if you have any kind of doubts, kindly please share your doubts in our message. Otherwise, you can send your voice. And just give them 5 minutes now. Yeah, I'll do that. Can you please put on your camera? Am I seeing? I do not know because. Okay, ma'am. Sure. Please. Hello. Hi, ma'am. Yeah, Mr. Ashish, please put your question. This is how you will cite in APS style if you are using a magazine and a newspaper article, in which you will write the name of the author first, then his initials, the publication year, the book or the title of your article, and if it is a journal, you will write the complete Journal of Comparative and Physiological Studies or Psychology, which volume and the page numbers. Are you able to see it? Yes, ma'am. It is good. Yeah. This is for magazine and newspaper articles, and this is for books in APA style. हाँ जी Hello. Jai Hind, ma'am. Very good afternoon. Hello, ma'am. Dr. Diti, good afternoon. How are you, ma'am? I'm so lucky to have you here today after so long. Thank you so very much, madam, for giving me an opportunity. No, ma'am, no, not at all. Always, you are always with me when I started my journey in Lucknow. From the day to till the date you are here, I know that future also you will be with me. Thank you for the class, there is no question about your class at all. You have taken such a fantastic class on the systematic literature review and bibliography. These two things are very, very much crucial phases in the research. Yes. Everyone can write the things, but how to write the bibliography, how to go with the this thing, reviewing the literature, they are just copy pasting. I'm seeing so many. Plagiarism is happening. Yes, so many. Then they will say, my plagiarism is so much, so high. Yes. So in that case, you took such a brilliant class, ma'am. Thank you so much. And I know that everyone is blessed to have you in the class. Means मैंने तो कभी नहीं सोचा and up to the end, I was thinking you are going to give any professor or associate. When you said I am only going to take, I become so happy. I told Soumya and Sunanda that Madam herself will take the class. Thank you so much, ma'am, for being with us. We are missing you a lot in Lucknow. And no one can fulfill your this thing place over here. Thank you so much, ma'am. Please bless always to us and my students and the others people. Thank you so much. Thank you so much. Madam, I thank you wholeheartedly from my bottom of my heart for giving me this opportunity. And I remember the Lucknow memories which we have shared, and it will always be there in my mind, fresh. And definitely, Mission Niramaya, you're doing a wonderful job. And under this Mission Niramaya, if you have brought out this national webinar series for our students, it is very, very motivating because these topics are very apt for our students to know and the faculty because we are taking up lots of evidence-based in our day-to-day life. All of us are progressing in our careers by doing PhDs, by doing masters, and when we are doing BBBSc. So whenever we are doing even a small study, we all should know that we should do it in a very right way, in a systematic way, in the way it is organized, and so that nobody can point a finger that this is cut, copy, paste. Then it is liked by, and these researches are always welcome. So we should learn, and that is the reason if Dr. Deepthi has said that evidence-based nursing research is the need of the hour. That is the reason Madam has chosen this topic, and all of you students will be benefited through this webinar series, and wish you all the very, very best in the next couple of days or till this weekend. I think you are having all the topics and many eminent speakers are there. Madam has chosen all the resource people very specifically and then incorporated it for you all. Thank you very much again, Madam. Ma'am, thank you so much. I'm wishing to meet you very soon, somewhere here and there. Thank you so much, ma'am. Take care. Take care. Thank you, ma'am. Take care, ma'am. Thank you. God bless you. Thank you.